Mackenzie Amos, and today I'm going to be doing inserting an NG tube, enteral feeding, and then removing an NG tube. So to start off, I'm going to verify my order that we're going to be placing an NG tube in. I'm going to gather all my equipment and I'm going to go into my patient's room. So knock, knock, knock. Hi, my name is Mackenzie Amos, and today I'm going to be doing your NG tube insertion. Can you tell me your name and date of birth? Okay, thank you, Mr. John. So I'm just going to wash my hands, don clean gloves. So while I'm doing this, I would be telling him what all I'm about to do, and I'm going to make sure he is in high Fowler's, which he is. So I'm going to give him this emesis basin in case he feels nauseous. Wrap this towel around in case anything gets on him. And then I'm going to open my supplies. Make sure I'm going to ask about allergies too in case he has an allergy to latex. And then I'm going to get him this ice water so he can drink while I'm inserting it. So I'm going to open it up and I'm going to check my patency. So I'm going to have him breathe in and breathe out. Okay, I'm going to use this left nair, so I'm going to take my tubing. I'm going to measure from the nostril to the ear to the xiphoid process, which is about here. And I'm going to mark with a piece of tape. Okay, now that's marked. I'm going to get my lube ready and I'm going to lube 3 to 4 inches. Okay, and now I'm going to have you, as I insert this, I'm going to have you lean your head back and then I'll tell you to put your chin to the chest while you drink some water, okay? I'm going to try to do this as fast as possible and painless. So ready, head back. There you go. Chin to chest for me and take some big sips. Okay, there we go. It's going all the way. So I'm just going to take a piece of tape and secure it into place. Okay. Then I remove all this. So while I check, I'm going to grab this. I'm going to check residual and pH. Okay, I got about 20 mLs. Come over here and check pH. pH needs to be between 0 and 4. I have 3. Okay, and then I will send you off to get an x-ray. So he's gone off to get an x-ray and it's come back. Okay, Mr. John, it looks like we're in the stomach, so I'm going to go ahead and secure with this piece of tape. It's more comfortable. I'm going to crisscross it. Okay. Then I'm going to go ahead and connect you to suction or feeding or whatever the doctor has ordered. So I'll put that up here and I'm going to remove my gloves, perform hand hygiene, and I will document the procedure I just performed, what size tubing, what nair I used, how the patient responded to it. Okay, so now I would get ready to do my enteral feeding. So I'm going to verify my physician's order and come into my patient's room again. So knock, knock, knock. Hi, my name is Mackenzie Amos. I'm doing your internal feeding today. Can you tell me your name and date of birth? Okay, thank you, Mr. John. Do you have any allergies I should know about? No? So I've kept my gloves on, but here at this point I would do hand hygiene and put new gloves on. So I will get my feeding. He has no allergies, so that's good, and I'll check expiration on this. So I'll shake this up. There you go. And I'm going to get my bag ready. I can pour this into the bag since we're doing a continuous feeding. I'll go ahead and prime it and I'll set this to a side. And so I'm going to go ahead and check for residual and pH before I start the feeding. And he is in high Fowler's. Okay, I got about 25 residual, and if residual is less than 250, I can put it back. If it is more than 250 twice or 500, I would stop and notify the physician or stop feeding if he already has one going. So I'm going to just put whatever I have left back in since it was less than 250. Okay. And pH was less than 4, so we're still in the stomach. So now I can talk about some of the feedings. I'm doing continuous right now. That was what was ordered, so I will set it up through the pump, and I will flush with some water before, and then along with come in every 4 hours to flush and check residual every 4 to 6 hours. With the gravity feeding, I will just hook it up and flush before and after and let it just go. A bolus, I would look at the physician's order and use the rate he gave. So I'm going to flush 30 ml before I connect it. I've flushed 30 ml of water. And I'm going to go ahead now, and I have my tube primed, so I'll attach that on and begin the feeding. So now I will discard my gloves, wash my hands, and I will document what type of feeding, if he had any allergies, along with change my bag in 24 hours along with the tubing. And that's it for that one. So now I'm going to remove the NG tube. So I'm going to verify my order to remove it. So I verified it. Come into my patient's room. Knock, knock, knock. Hi, my name is Mackenzie Amos, and today we're going to be doing your removing your NG tube. Can you tell me your name and date of birth? Okay, thank you, Mr. John. I bet you're so excited to get this removed, so I'm going to disconnect this from any feeding. Stop your feeding. Pull this to the side. And right here I would have done my hand hygiene and put on new gloves, hand hygiene and put on new gloves. But I've just kept them on from the previous one. So now I'm going to just wrap this around you just in case we get any mess on you. Give you this in case you feel nauseous after. And then I'm going to go ahead, have disconnected it already. So sir, while I'm doing this, I'm just going to have you hold your breath until it's done. I'll try to get it out as fast as possible. Let me remove this tape from you. Okay, and I have my biohazard bag right here. Gonna put it in once I'm done. Okay. So sir, can you hold your breath? Hurry, 1, 2, 3. Kind of just twist it up. And I'll place in the biohazard bag. And then I will perform nasal care, oral care if needed, or give them a tissue. And I'll remove my gloves and perform hand hygiene. And here I will document that I removed the tube along with how the patient handled it.